What is red light therapy?
Red light therapy is a treatment that uses low-level wavelengths of red and near-infrared light. Unlike ultraviolet light, red light does not burn the skin. Instead, it is thought to stimulate cells and promote healing. This therapy has become increasingly popular among athletes and fitness enthusiasts for speeding up recovery after exercise.
How does red light therapy help muscle recovery?
Research suggests red light therapy may reduce muscle soreness and inflammation. The light penetrates the skin, reaching muscle tissue and supporting cell repair. Some studies report decreased, delayed onset muscle soreness, faster healing, and less fatigue in those who use red light therapy after workouts.
Scientific evidence. What do studies say?
Clinical studies have shown promising results for using red light therapy in muscle recovery. Trials have noted reduced markers of muscle damage and inflammation, better strength recovery, and quicker return to performance. However, more large-scale studies are needed to confirm benefits and identify optimal usage protocols.
How to use red light therapy safely?
Red light therapy can be done at clinics or with home devices. Sessions typically last 10 to 20 minutes per area. Safety profiles are good, but it's important to follow device instructions and not overexpose your skin. Consult a health professional if you have medical conditions and avoid shining light directly into your eyes.
Integrating red light therapy into your routine.
For muscle recovery, red light therapy can complement regular stretching, hydration, and good nutrition. Consider using it after workouts, focusing on sore or fatigued areas. Track your progress and adjust based on comfort and results. While not a miracle cure, it may help support recovery alongside your usual fitness strategies.